Hi guys, this is Vi from MedPrep Plus. Hope you're all well. Just a very quick video on some tips in communicating and consulting with patients who are extremely hard of hearing. If possible, obviously try and obtain their preferred method of communication. Do they prefer you speaking loudly to them? Do they prefer you speaking slowly? Do they prefer you writing things down? And then try and comply if practical, given the time constraints and everything. Before you start talking, it's a good idea to make sure that they're looking at you so that they can lip read. Remember to speak clearly, but not too slowly, and also do not exaggerate your lip movements, as this can get quite confusing. Remember, these are patients who are used to lip reading all their lives, or at least a significant proportion of their lives. Ensure good lighting and make sure your hands are away from your face and you're not covering your mouth when you're talking to them, so they can, again, lip read and also see your facial expressions, because sometimes that is a great way of a non-verbal communication. It does occasionally mean in order to have effective communication with some patients, you may have to remove your face mask. So that's up to you. You have to do that risk assessment and see whether it's safe to do so. See if it's possible to have a family member present or a sign language interpreter. However, please make sure that you're always looking and talking directly to the patient and not someone else. Just because somebody's wearing a hearing aid does not mean they can hear normally. Hearing aids cannot restore normal hearing. At the end of the consultation and also during the consultations, it is important to just occasionally check the patient's understanding so that you are reassured that they fully understand what you're telling them. If you haven't done it, deaf awareness training is an extremely useful thing to do and will really enhance your communication skills when it comes to dealing with patients with difficulty in hearing. It is a very, very common problem present in all aspects of medicine. Also remember, if you are consulting patients remotely, emails, text messages are extremely useful tools.